The second area of policy which I'd like to share with you, and again to show how we are keeping the direction while adjusting the implementation, is our social safety nets. How we need to care for one another. We are living in a time of rapid changes. Last 5 years, you've seen the changes. Next 5 years, I think, will be many unexpected surprises to come. And it's important that nobody is left behind as we dodge and shift and we find our way through the troubles. We aim for inclusive economic growth. We want to encourage people to be reliant, self-reliant, for families to give mutual support to one another, and to be able to look after themselves as much as possible. But there will be a minority who cannot keep up or who will fall on hard times. And for them, we need a social safety net. So the way we have done it, which I think has been successful, has been to give people assets, especially in HDB flat, help them become self-reliant by giving them a very good education, provide them affordable medical care through the 3 M's, MediShield, MediSave, MediFund, and also government subsidies to the hospitals, and then to have targeted assistance to those who need help through many helping hands. So the result is nearly all citizens are employed, housed, and able to look after themselves. The last 5 years have been stressful, and so we've introduced new programs which have helped. Workfare, to raise the income of lower-income Singaporeans. ComCare, to provide tailored support for individuals and families with specific needs. And since we introduced ComCare 6 years ago, we've had 200,000 people helped by the schemes. And so they've got a blossoming of all kinds of local programs involving the community leaders, the grassroots groups, the VWOs, doing interesting things on their own initiative with government support and backing. For example, they distribute food to needy households, or they teach low-income families budgeting skills. This is not monopoly. This is called MoneyWise. And those of you, Southeast CDC, you may know, is a program introduced by Southeast CDC to teach low-income families how to manage and budget their money. And quite successful in getting them to be able to save, to allocate, to learn how to cope. Or we have people who are befriending the elderly, taking them on outings. This is a group who took wheelchair-bound elderly to Marina Bay. I don't think to the casino. Or maybe you just take them out for a meal and enjoy companionship together in a hawker center and cheer up their day, add some warmth and brightness to their lives. And that's how I think we can make a big difference to the lives of Singaporeans who need help. The next 5 years, there's going to be rapid change. Our aging population is going to throw up new challenges, and there'll be other groups which will have specific needs which we've got to tackle. So we'll keep on improving our social safety net, enhancing it, keep the present approach, but improve the schemes. And I'd like to talk about 2 things which we will be doing tonight. One is to do with medical care, and particularly with outpatient treatment, especially for older people. Many Singaporeans worry about medical expenses, especially if you are older or you have an elderly member of your family. The 3M framework, MediSave and so on, works well for inpatient care. But for outpatient treatment, I think we can do better. One group of these elderly are those who need long-term care. They may be bedridden or they may have Alzheimer's. And I talked in a Chinese speech just now of some of the things we are doing to help this group. We'll give more support, expand services, make the services more affordable. Another group is patients who have chronic ailments, maybe high blood cholesterol, maybe high blood pressure, maybe diabetes. And amongst the people who are in their 70s, maybe half will have one chronic ailment or another. And when you have something like this, you will know that you need regular checkups and you need long-term medication. It's not that you take the pill 10 days and the problem is cured. You have these pills, take it for the rest of your life. Every 3 or 6 months, see the doctor. Doctor will examine you, adjust the dosage. 6 months later, see you again. Try and keep well for as long as you can. But the pills can be expensive, particularly over a long period of time. And the low-income patients, sometimes they tell me they may skip an appointment because they fear they can't afford the pills. Or they may say, the doctor says I eat this every day, but I take it every other day instead to save money. Which is not the way it's supposed to be done, because if you do that, your condition will worsen and more trouble will come later on. Serious complications. So I think that we should make outpatient care more affordable and accessible for this group. The elderly and the not so elderly. We have a scheme to help elderly chronic patients like this. It's called a Primary Care Partnership Scheme, PCPS. Helps the low-income elderly and disabled. What it means is you have a card, you're registered. You can see your GP instead of going to the polyclinic, but you get a subsidy like you're going to the polyclinic. So it's more convenient, you have more choices, and you probably get faster service. We will change this scheme, which is now quite restrictive, and you have to be 65 years old before you're considered for this scheme. We will change it so that you can start at the age of 40. Because when you have high blood pressure or cholesterol or diabetes, by the age of 40, it's beginning to show up, particularly if you haven't looked after yourself. And when you have conditions like this, the earlier you start treating, the better I think the results will be. And you have to cooperate, and we will make the scheme to help you to be able to have consistent treatment over a long period of time. And we will also revise the income criteria to include more households, so that a broader range of households can come in under the scheme and can get consistent, good, long-term care. We will also make the medication more affordable to lower-income households. We will expand the drug list so that it covers more drugs, and we will increase subsidies for the more expensive drugs with safeguards so that those with chronic ailments or cancer where chemotherapy can be very expensive, well, you'll get more help. I think these are major moves. We will implement them carefully, and as we gain experience with them, we can consider how to fine-tune and how we can take further steps forward. We have to be very careful because you don't want to end up like the Americans, where the government health schemes have eaten up a huge amount of the budget, and financially and fiscally is a big problem for them. But we can do better, we will do better, and MOH is working on it, and they will announce the details later on. So this is one area where we can improve our social safety nets. The other area has to do with families who have children with special needs. They may have dyslexia, they may have autism, they may be ESN, they may be hearing impaired, or one of so many conditions. But they have long-term special care and education needs. And then the families will worry not just over the costs, but also about helping them overcome their disabilities and develop to the maximum, so that they get the right stimulation, right education and training, right coping strategies. The government is already supporting people doing this. We support early intervention. We support special education schools. We also have support in mainstream schools for children with mild learning disabilities, like dyslexia. The special education schools are doing good work. One example is Pathlight School, which happens to be in Teck Gee. It looks a beautiful building, and it's for children with autism. Now it's got about 600 students. I know because I visited it and I held my National Day observance there this year, recently. And these are the Pathlight students performing. And they presented me a beautiful drawing. It's a drawing of Joo Chiat shop houses done by one of their students. So it shows that you may be a special education student, but you can have very special abilities too. And in the right environment, they can thrive. But there's a long queue for places in some of the SPED schools, some of the special education schools, and I often meet parents asking me for help to get their children in. So we will expand capacity in the special education schools and also in the mainstream schools. And we will strive to raise the quality of the special education schools so that the children get education which will help them to overcome their disabilities. And we will also increase financial assistance for households who need more help. And this is something which the Ministry of Education will do together with MCYS, consulting the community to work out the best approach, because this is something which needs many helping hands. The community has to play its part to help to integrate those with special needs into our society. And one good example of a ground-up effort, not depending on the government, is the Joan Bowen Cafe. Joan Bowen is a young lady with special needs. Her parents wanted to solve a problem. They wanted a safe working environment for her. So what did they do? They opened a cafe. And they called it the Joan Bowen Cafe. The cafe is at Jalan Wangi, which is in Senate Estate. And it's to help youth with special needs like autism or Down syndrome. So it's got a crew of 16 staff of such kids, actually adults, and they are trained to run the whole cafe. Here you see them cooking, and this is Joan in the middle, putting the sauce onto the dish. And they learn food preparation because they have a manual with pictures and detailed instructions, exactly how to do each step, what to put next. And with patient guidance, gradually they gain confidence, and they are able to serve customers. And you see the customers are happy, and the cafe is successful. So they've just launched a second outlet at St. Andrew's Village. So if you have a chance and you live near there, please drop in and have a drink. So we will do our part as the government, but the community, parents, VWOs, please come forward, help us to carry this and deal with this challenge. You can do a lot. We will progressively improve our social safety net, update our basic schemes, whether it's a CPF, whether it's the MediSave schemes, and so on. And we will do more for other groups which have special needs as these issues emerge. And we'll keep up our effort to help the poor, make sure that nobody is left behind. But while we do all these things, we have to be very careful we don't become a welfare state. Take the example of Greece. You know it's in trouble. But why is it in trouble? It's a small country. Population is about twice ours. The GDP is about twice ours. And its former Prime Minister, Papandreou, a generation ago, he built a generous welfare system, protecting the Greeks from competition, giving them jobs in the government, welfare benefits, pension benefits. But it was not affordable. And so the country has gone broke and has been set back for many decades. Now, Papandreou Jr., the son, is trying to wind back these benefits and put the country right again. It's very painful. It's going to be very, very difficult. And even then, they can't do it by themselves. They are being bailed out by the EU, so far twice. And the problem is not settled. In Greece, if you run into trouble, the EU is there to look after you. In Singapore, if we run into trouble, who is going to be standing there helping us to get out of the hole? So I think the best thing is don't get into a hole and maintain a sense of self-reliance and personal responsibility because that's the best way for us to succeed. Our competition is not getting less worldwide. It's getting more competitive than ever. And we cannot afford to think that we don't have to try hard because the state is there, and if something happens, we can always fall back on the government. 政府無類. That's the most disastrous thing you can say, and the most harmful to Singaporeans, because you're misleading them, and it will lead to big trouble. Singapore can only succeed if every one of us works hard, does our best, and helps others to make progress together. And then we will prosper, and then we will have the social safety nets which work for us.